Hello friends, this is the modern world of curiosity and everybody asks me what exactly you do different in genetic based treatment. Today I am going to try to answer this. I'm sure it will satisfy your curiosity to a lot extent. So please stay to the last and understand how this treatment is super specific for you. See, a lot have been talked about the general treatment. For example, if I want to talk about general treatment and I talk about thyroid, hypothyroidism, all over the world there is a single blanket treatment. It is thyroxine supplement. If we talk about hypertension, the majority cases, 80%, 80 to 90% today, 80% are getting telmisartan, and then rest of the 20% are getting all the antihypertensive put together. Similarly, if you talk about the diabetes, again there's a blanket treatment. So the problem with the blanket treatment is that it is actually insulting the human's uniqueness. See guys, let me put it again straight. Every individual is unique and every individual is passing through some different kind of situations and circumstances throughout his life. And now these situations and circumstances, they are unique to every individual. Also, they affect every individual uniquely. So whatever impression an individual carry in the mind and his genetic structure, all are unique. So every disease is unique. But what we do is a blanket treatment. We give everybody the same or a similar kind of a treatment. Now the treatment, this treatment is actually aimed at the control of some signs and symptoms, and therefore it is successful in control, but it can never help you in reversal. So then what we do different? We do exactly what is not done in conventional treatment, one, and what should be ideally done in any treatment. That is the name of the advanced genetic holistic treatment. So then let me go deeper. Let me dig deeper because I know this will not satisfy your curiosity. Saying we do whatever is needed and whatever is not done in conventional treatment will not satisfy your curiosity, but this is the truth that we do whatever it takes. Now let me give you some example. There was a patient of leukemia. I talked about this leukemia patient in some time ago, but I would like to mention it here. There was a young boy of leukemia. He was on chemotherapy and radiotherapy, and when he came to me, he was very much sad, depressed, not eating well, and he was looking like they are losing the hope of life. His parents said, actually, we are very worried. The way he is living away his appetite and not eating, so we don't think he will be alive for long. He is not even tolerating the treatment he is taking. So now situation was very tough. Now what should I do? Should I just, okay, yeah, he's there, okay, give the medicine and send him? This is not going to work because whatever medicine you give, it has to be supported and responded from inside. I will give a pause here because this is the most important thing. See, when you are giving some medicine, if you don't get a response from within, this medicine is going to be useless. I will quote here Dr. Hahnemann. Dr. Samuel Hahnemann, the father of homeopathy, said, if you just give medicines, you are not an intelligent doctor. Yeah, there are many things beyond medicines. Who is going to think about that? This is also duty of a doctor to think all around, to think in a holistic way, to think in every possible way which can actually benefit you, benefit patient, benefit sick humanity. So Dr. Hahnemann at one place rightly said, every intelligent physician will first remove the exciting and maintaining cause. What does this mean? When he says every intelligent physician will first remove the exciting and maintaining cause. And suppose exciting cause here is the mind, then what? We cannot remove mind. I'm not talking of removing mind. But if your exciting cause is the mind or the stress or your daily routine influencing your mind or your office or your boss or your wife or your husband or whatever, if the exciting cause is present in your daily routine, then what should be done? Tell me, this is going to be the most important thing of today. I want to ask you the question, what should be done in this case? Just, okay, no answers? Because see, you have to remove the trigger, isn't it? Okay, let me replace this example with a very simple example. Suppose there is a thorn prick. I get a thorn prick. The thorn goes inside, or okay, here it goes inside, and now it is paining. There is a pus formation, there is suppuration, and I am giving medicine. What will happen? Check it out. What will happen? If there is a thorn prick, I am not removing the thorn. I am giving medicine. I am applying my, or maybe anybody, super intelligent doctor. I'm doctor who tries the best, right? So I am giving some medicine. A super intelligent doctor is giving medicine. Some scientist is giving medicine. The world's best physician is giving the medicine, but thorn is still there. The prick is still there. It is not removed. What will be the result? Result will be surely zero. See, now this is very simple because we can see this, right? We can see this. Now coming back to the diseases we are talking about high blood pressure, heart diseases, we are talking about diabetes, and if there is some prick in your mind, or there is some thorn through your mind, or there is some trigger from your mind, or from your life, or from your situation, then what to do? Now compare, maybe for example, let me tell you a simple thing. You are in an office and you and boss are in a stressful relationship. You daily go to the office, you daily have to face that boss for 8 hours, and you are taking the best doctor's treatment to reduce your blood sugar and reduce your blood pressure. Will it act? Or to be very precise, will it act effectively? Give me the answer. Hi, Mr. Abhijit. Hello, Rukmini. Rukmini says, sir, you gave me a number, but I couldn't copy the number. Okay, Rukmini, I will give you number once again. Yes, Abhijit, you are right. You have to go to the root cause of the issue. And root cause everybody knows, for all these chronic diseases, root cause can be as simple as your stress. What are you doing about it? So people often ask my team of doctors, when I give them a link of a booking free consultation, they book the free consultation, they want to know what exactly you do in genetic based treatment. Let me be very, very precise. It is the advanced genetic holistic treatment. And we try to address the inner core issue. We try to address the inner core issue, and this inner core issue, nobody knows without study. For example, I get 10 patients of diabetes. One can have some maybe a stress with the boss as an issue, and sir, actually my boss is a jerk and I cannot tolerate him. As soon as I see him, my BP shoots up and my sugar shoots up. What to do? Replace the boss, leave the job. They're easier said than done. Then what to do? Because mind is having the constant irritation, constant source of a stress. How can you solve this problem without taking care of this stress? You can take the best tablets, you can take telmisartan, you can take all kind of gliptins and insulin, everything you can take. You can take any medicine in the world, but the first question, will it help? Okay, it is helping. Yeah, great. It is helping. But will it help at the optimum doses, or you have to go higher, doses? Yes, even if first it will not help, and if it helps, you have to go very high up in the doses. Now these doses are ready to cause the side effects like kidney failure, liver failure, heart attacks, and cancers. So are these higher doses justified? No, dear friends. So coming back to what we do, we identify what is the trigger, what is the exciting cause, what is the cause which is maintaining this illness, and we try to remove that. Now people will ask, okay, how do you try to remove that? Guys, it is completely personalized treatment. Whatever the cause is, the treatment is according to that. It's very simple. For example, if somebody is having a diet issue, actually his diet is very bad, and therefore because of the poor dietary habits, he got diabetes. Now the approach in this case is going to be completely different than all other cases, because the cause in this case is completely different from all other cases. Or okay, some patient says, actually my whole of the family is having diabetes. So then what to do? So now changing just diet is not going to do good, or working just on the mind is again not going to do good. We have to work more deeper. We have to change his genetic imprints. We have to work on the genetic expressions. Now, as soon as I say this, or my team says this, the magic of confusion happens. The magic of doubt happens. Guys, let me tell you very, very clearly. Science of epigenetics have proved everything, that you can now influence genetic expression without changing the genetic structure. Now, the biggest problem is everybody is talking about epigenetics. Nobody is using it for healthcare. Fortunately, we have devised the method by which we can actually influence your genetic expression. Just imagine, if we can influence your genetic expressions, we can actually influence anything and everything in your health. Absolutely anything. Now the question comes, how exactly we do? Guys, please understand, it is completely personalized. We go to everything you know about yourself, as also everything which you do not know about yourself. But for example, let me tell you, there's a person who is having a large nose, and there's a person having a small nose. Now, what does it mean for you? Is it just anatomical defect or anatomical disformity? No, guys, everything has a meaning. We take everything. If your face is a square and the other person is having a round face, we also take that. Now, you are worrying, how can doctor know what I don't know about me? This is one proof. We have so many things in place to understand you better than you understand yourself. Therefore, you must be seeing, in almost every case, we ask for a picture, a photo, and also we ask for a video. We do this almost in every case, unless the case is super clear in front of us. So we go that much deeper, which you have never even thought. For example, we take your childhood history. Even for kids, we take the history when they were inside the mother's womb. Now, kids don't know about this. But we know how a shock in the life of a mother when she is pregnant can influence that kid. And maybe that kid may be born with a diabetes, or maybe with a hole in the heart, or that baby can be prone for depression. There are so many things that can happen to baby. But who studies that? We do. So guys, whenever you ask a question that how exactly we do, please understand, it is personalized. It can happen only after the case we get the case. Let me tell you, I will not tell here about disease. But in this case, We worked on a diet for almost 10 to 12 hours. 12 to 12 hours. Can you imagine? We just adjust his diet at a micro level. I'm talking of one single case. I also remember a case where we worked on mind for a full 10 hours. The case is on YouTube as well. Right from the starting in the morning at about 10 a.m. till probably 8 p.m. Patient was there with us. We are studying, analyzing what can be done. Oh, this is the issue. Maybe we can work on this probably. Oh, no, this is not. Maybe working on something else is going to help better. So we are working for 10 hours on a single case. And in this case, diet was not even 1 minute. It was all mind and mind and mind. I also remember a case we work on just the finding genetic traits. Patient was saying, I'm confident, I'm this, I'm that. We said, forget it all. We didn't take anything. We went into the childhood and took the genetic traits, the gems of the genetics from his childhood. So guys, please understand, every case is a different case, and every time we have to apply complete 23 years of experience. Some unfortunately want to take this 23 years of experience with a 15-20 minutes of call and some search of Google. Guys, this is not possible. If you want a general treatment, probably we are not the right people. We are not the right people for general treatment because we do not do general treatment. If you want a very, very specific, personalized, completely tailor-made, completely individualized neurogenetic level of treatment, probably we are the only option. We are the only option. Because understanding neurogenomics and then applying neuroplasticity, understanding genetics, then applying genetically targeted medicines, plus epigenetics, then understanding diet from the perspective of a genetics, and then applying nutrigenomic methods and nutrigenomic counseling, then understanding the tendency your body is carrying and then changing that tendency, understanding the tendency your mind is carrying and then modifying or substituting that tendency by what we call as a mind transplant. There are lots and lots of things we do with almost each and every case. So if you want just one answer, what we exactly do, the best answer again will be the first sentence, whatever it takes. I will tell you one interesting story. I remember a case of pemphigus vulgaris. This pemphigus vulgaris case I got 3 years back. Now 3 years back, they talked with me, they came here, they were admitted in my hospital. The patient was admitted in my hospital. He was very critical. He was very severe. Whole of the face and the body was having bullous patches, large balloon-like patches, like this, and then this, and all of the body, there were large patches. When I saw that case, it was clearly an autoimmune case. They asked me, can you treat that? We said, yeah, we treat only these kind of cases where everybody have given up. Autoimmune we do, and we do skin diseases, we do critical illnesses, and you are exactly suiting what we do. So he asked her, how exactly? Now, they were not of so elite and Google background, so they didn't insist on knowing about this, but they said, sir, how much time I will take? It will be needed in this case. As is the autoimmune disease, it will take approximately 1 to 3 years. So they said, sir, what to expect after 1 to 3 years? Because this is critical and doctors said it is not going to get cured and you will be probably dying in 1 to 2 years. I said, you expect life first. We'll try that you remain alive for more than 3 years first. Plus, we will see the disease get reversed, and we can reverse such diseases because we have already done it. They said, sir, we can means what? I said, we can means there is a 70 to 80% probability that will reverse this. So they said, what about 20%? I said 20% we are not God, so we cannot give any kind of a 100% guarantee. They said, that's what we want. We want a 100% guarantee. Nobody can give 100% guarantee in this kind of diseases. It's pemphigus vulgaris, is dangerous, life-threatening diseases, and most people die soon in 2 or 3 years. They said, it's better we will take allopathy. I said, go ahead. They started allopathy. They took allopathy for 6 months, 1 year. Then they become very, very critical and they came once again. I repeated the same thing once again. But he was very bad then. So I said, now that as the disease have progressed, your chances have gone down a bit. But still what we do is the world's best treatment for you. They decided, sir, you are not taking guarantee. I said, I never give it guarantee. They said, okay, we will continue the allopathy. I said, great, go ahead. Just today, it is now almost 2 years, 2.5 years almost. They said, relative came, they said, sir, patient is very critical. And doctors now said that they will not treat him because he is going to die anyway. They are asking, can we bring? What should I answer? What should I answer? I said, okay, bring him, but chances are far less now because you have lost your precious 2.5 years. My question to you, are you losing these precious years by just keeping the check over the reports? By doing control of the reports? Don't do that. Go to any good homeopath near your vicinity and check it out that he is doing the highest level of homeopathy first. You may not be able to check it out whether he is doing a genetically targeted homeopathy, but at least a reasonably scientifically good homeopathy. And then check it out whether he understands what else he needs to do. Giving medicine is probably not the toughest job. It can be, in most cases, the easiest job which everybody is doing. But understanding human genetics, understanding human psychology, understanding the dietetics, understanding the diet and regime, understanding the lifestyle, understanding what correction you need to make in your mind, what correction you need to make in your belief system, and what correction you need to do in your thought pattern. Probably this is the most challenging thing which every doctor should be well versed with. If you just depend on medicine, probably Dr. Henneman, every intelligent physician will first remove the triggers. The exciting cause or the exciting triggers, or the maintaining cause, the maintaining triggers. Now either your doctor should do this, or you should do this, or you should involve 2, 3, and 4 people to see whether you are on right track or not. So guys, talking any level of talking, most people ask me, can you suggest me a medicine? If I go to, even right now, if I go to, or you go, why should I go? You go to the post about acidity, there are at least 5 to 6 people who ask, can you suggest me the medicine for acidity? I'm very, very disappointed by such questions because I've told medicine is not everything. One thing is that medicine is not everything. Second thing is that medicine will be personalized. If 10 people of acidity come to me, one is suspicious and angry jerk, he will get a different medicine. And one is a very docile guy, he will get a different medicine. So everybody will have a different medicine. How can I tell a blanket medicine? It is not like ranitidine, or it is not like omeprazole, it is not like pantoprazole, it is not like a fixed medicine or a set of medicine which is going to help you. You will be helped by only one medicine which is going to match your neurology, psychology, genomics, dietetics, and habits, everything matched under one medicine. Now here lies the major skill. And you'll ask, sir, what is that main medicine by which I am going to get benefited? Guys, I don't know. I will know only after I study and my team works on. We are a team of 15 doctors and psychologists, and we are working on your mind and genomics and genetics and neurology. We are studying the every bit of it and then coming to the conclusion what kind of medicine you will need, what kind of activity do we need to be done with you, what kind of mental behavior pattern change you need, and what kind of exactly things we need to do. And after all this study, when we come to know what kind of exactly the things need to be done, there starts your treatment after all this study. So this is the kind of personalization we are giving to you. And let me tell you, personalized treatment are the highest level of treatment possible. Let me give you an example. If you go to some party, and there is announcement made, hello guys, everybody is requested to do dinner and then only go without doing. I'm not a good at announcement, so please understand. So please everybody take the dinner and then only go home. Now this is the general announcement. And just imagine a scenario. Somebody comes. Hello, Mr. Abhijit. You are requested to take dinner and the table is here. So please may I guide you to the dinner table? So can you see the difference? Personalize the thing are just simply the best, because personalization is the thing which is actually, now this is very important. The personalization is thing which is actually hitting the core of your genetics and neurology and psychology. This is the only way by which diseases are treated. Unfortunately, in medical science, in contemporary medical science, we are missing the personalization. We are doing some tweaking nowadays. Some kind of personalization is done, but majority, 80%, 70 to 80%, the treatment is a blanket treatment. You can check. If you are diabetic, call another diabetic and check it out. Maybe he's taking the same treatment as you. If you are hypertensive, call your friend who is hypertensive. Probably he's taking the same treatment as you. But guys, you don't even wear a same shirt. You don't even try a same trouser. You don't even go for the same shoes and footwear. You don't even go for the same perfume. How can you go for the same treatment? I think this question itself talks a lot. So what we do, what exactly we do, we exactly understand you first. Then we exactly understand the data, what we got from you, and then we analyze them into genetics data and normal data. And then we plan the medicine and your treatment and your mental treatment and your psychology and your diet and your lifestyle and the thought you should think of and the book you should read and so many things we personalize. And guys, let me tell you, whosoever has followed this, almost, see, 80% is the thing which I say, but almost 90% or above, everybody gets results. Everybody. I'm so sure about it that now we are starting the franchises. Now we have decoded how we can help millions of people through franchises. So we have started franchisee, and we are proud to announce that the franchises are already started, already booked, and a lot of people are taking interest in our franchises. So we'll be reaching soon wherever you are. If you want to take treatment right now, you can call right now and we are there to help you. Right in the title, I have given the link of booking free consultation. If you still want to know more about it, you can write it on my email ID directly, drravi@idealcureforyou.com, or you can book a consultation by that link, and you can talk to our doctors. They will be happy to help you. But please don't expect the Google knowledge from them, because we don't believe in Google, because Google is still learning. We are actually doing far better than what Google is doing. So here I am giving you my email ID so that you can write your disease concern in email ID. Right now, don't check our website, because website is in updating mode. We are entering into franchisee, and I'm bringing some great surprise for you in my website, which I'll not be revealing right now, but it is in the working model, so it won't be seen. My personal email ID for you. So now let me acknowledge whosoever is here. Mr. Abhijit, thank you for being here. Rukmini, most welcome. Sir, you gave me a number, but I couldn't copy the number. Okay, I will give you a number again. Mobile number. Now this number is a very busy number, so if you find that you are not able to reach, please drop the message and you will always get a call, don't worry. Or go to the link and register for consultation. And thank you, dear friends, for being on this live. Mr. Vasan Srinivasan, yeah, thank you, Mr. Vasan, for your appreciation. Hello, Ruby Thakur Bhardwaj, welcome and good evening. Mr. Stanley Joy, you all are great. See, you are inspiring me to do better and more. So thank you, Stanley. Thank you, everybody, for being in this live. I'm very grateful because you give this, you give your comments, you give your time, and you share it. My yesterday's post have been seen by more than 7,000 people in just one day. So thanks for your sharing. I know you have been generous enough to share and comment on this post. So thank you. Share this to as many people as possible so that people learn. Mrs. Satyanarayana, thank you for your kind words. Your words of appreciation help us to reach more and more people in as much speed as possible. So thank you, all of you. Thanks in advance for sharing this to as many groups as possible, as many Facebook groups and WhatsApp groups as possible. Thank you. Bye-bye. Take care. Good night and stay healthy. Thank you. Probably I have given link already. It doesn't want me to end the video, but still I will end the video today, but tomorrow at 9 p.m. we will still meet once again. Thank you.